Hi, my name's Mia. I'm going to be your nurse today. I'm going to be doing a head to toe assessment on you. If you could confirm your name and date of birth.
John Cameron Sonis, November 11th, 1998.
Okay, awesome. I'm going to check your wristband as well. Make sure that matches. Awesome, it does. I'm going to go wash my hands and put my gloves on, and then we'll get started, okay? Okay. I'm going to take a look at his scalp. Note the hair coloration. Make sure the hair is evenly dispersed. There's no bald spots, no lesions, no masses, no discoloration, and no nodules noted amongst the scalp. I'm going to take a look at the face. Same thing, note for lesions, edema, and discoloration. Take note of skin temperature and moisture, and evenness of coloration for the patient. I'm going to palpate the external ear. I'm going to take a look of the skin surrounding, make sure there's no bruising in the back, make sure there's no lesions or markings or abnormalities within the ears as well. I'm going to palpate your sinuses, note for any tenderness on the sinuses, and tenderness can be indicative of sinus pressure because of congestion or sinus infection. I'm going to palpate the structure of the nose, note for symmetry of the nose or asymmetry of the nose on the outer external structure. I'm going to take a look up his nose and note for any discharge and the septum. Note if it's deviated or symmetrical. Note if the nostrils are equal in size as well, and if there's discharge, take note of the color and how much is coming out. Going to take a look in his ears, pulling them up and back to take a look at that tympanic membrane, and the normal should be a grayish color. If there's redness, it could be indicative of an ear infection, or if I see any scarring or tubing, could be due to multiple ear infections at a younger age, and it could be due to damage to the tympanic membrane. I'm going to, with my pen light, have you look over my shoulder, and I'm going to watch your pupils. Good. And the next one. Good, I'm just watching that they are equal and reactive to light and accommodation as well, and that they are round. There's no asymmetry of the pupils. And then with this, I'm going to have you follow my pen light with just your eyes, don't move your head. Good, and all the way in. Awesome, just looking for the symmetry of the eye movement, that they move with ease. There is no nystagmus, no delay of one eye, and that they move through the same motion, as well as both coming inward and down for convergence. I'm going to palpate your jaw muscle, have you open, close, clench. Good, just checking for tenderness and popping, and noting that the muscle is contracting. I'm going to palpate your preauricular, your postauricular, tonsillar, occipital, submandibular, submental, deep cervical, superficial cervical, clavicular, lymph nodes, noting for any swelling, tenderness. Typically they're not felt unless there's an infection present, and there may be some tenderness noted there as well. I'm going to palpate the neck structure, trachea in general, clavicle, just making sure that there's no abnormalities noted after I take a look at those structures. I'm gonna have you look down. Good. Bring your head all the way up. Look all the way up to the ceiling. Good. Relax. Then I'm gonna have you bring your ear to your shoulder. Bring your ear to your other shoulder. Now look over your right side. Look over your left side. Good. Go ahead and look over that shoulder again and push against me. Good. Look over that shoulder. Push against me here. Good. Testing the strength and range of motion of your neck, noting a 5 out of 5 for full range of motion and full strength, and no deviations. I'm going to have you smell something for me, so I'm gonna grab a wipe or an essential oil. Right now I have an alcohol wipe. The patient's gonna close his eyes and smell. Good. Testing for the olfactory nerve. He's gonna tell me what he smells, and if he can smell it and it is correctly what I have under his nose, then that nerve is intact and there's no blockage of the nasal passage. If he can't smell it, it's due to either congestion or an issue with the olfactory nerve. Now, I'm gonna have you close your eyes. Does this feel the same as this? Does this feel the same as this? And does this feel the same as this? Good. I can also do that with the end of a paper clip and test for pain receptors as well. I'm going to have you do full range of motion in a second after I palpate and note of any masses or lumps or tenderness, and note for atrophy of the musculature in the arms and the chest and the traps. And now I'm going to have you go through the full range of motion of your shoulders. Bring them all the way up. Good. All the way down and back as far as you can. Good. Normal. Now up and out to the side, and then all the way down. Good. Now I'm going to test your strength. So go ahead and bring your arms out. Don't let me push down. Good. Bring your arms out like this. Don't let me push down, and don't let me push up. Good. Now go ahead, arms out like this, and bring them all the way up. Push against me. Good. Pull. Nope. Pull. Good. Bring them all the way out. Hands up like this. Don't let me pull you down. Don't let me pull you down. Good. Hands back like this. Testing flexion and extension of the wrist. Good. Hands up. Open. Close. Fist. Open. Good. Squeeze my hands as hard as you can. As hard as you can. Good. And that's just going through range of motion of the shoulders and flexion, extension, abduction, abduction, and then flexion and extension of the elbow, testing for the range of motion and the strength, noting a 5 out of 5, and testing for symmetry of those movements and those muscle groups, as well as the fingers, making a fist and being able to squeeze. I'm going to go back out to your head. I'm going to ask you to puff your cheeks. Good. Smile. Good. Frown. Stick your tongue out. Open your mouth. Say ah. Good. Now move your tongue from side to side. Good. Just looking for the symmetrical rise of the soft palate and the uvula, and making note of any tonsils and if there's any abnormalities with the tonsils. Noting for any deviation in the mouth during those facial movements, and any deviation in the tongue during that tongue movement as well. Symmetry is noted throughout the face and the facial structures, and the ears as well. Good. So I'm going to take your pulses and then do some lung sounds. So I'm going to take pulses bilaterally for 30 seconds. And I'm going to multiply that by 2, noting for a pulse range between 60 and 100, and a normal 2+ pulse rate and rhythm. Anything under 60 is bradycardia, anything over 100 is tachycardia, and we'll note for that in the brachial pulses as well. And then for the carotid pulse, one at a time. I'm taking them bilaterally, except at the carotid, to note for any change in pulse and make sure that the pulses are the same throughout each limb. I'm going to now listen to some lung sounds after I know of any lesions or abnormalities in the chest area or the abdomen area. If they have tattoos, I'll mark that down as well. Any scarring, any swelling, and any discoloration, as well as temperature and moisture of the skin in that area. I'm gonna have you breathe in every time I place the stethoscope on an area, just one breath for me. Good. And one more. Good, I'm gonna listen with my diaphragm and my bell side. And I'm going to note of the normal sounds of vesicular, bronchovesicular, and bronchial. Vesicular is heard along the most of the peripheral of the lungs, and bronchovesicular within the middle sternal area and within the scapula towards the vertebrae. And then bronchial is heard closer and over the trachea. As normal noises, I'm going to note any crackles, wheezes, rhonchi, and any abnormal sounds coming from the lungs that are indicative of emphysema, asthma, bronchitis, or other pulmonary issues. But I'm going to listen to your heart, starting on the right side with the aortic, second intercostal space. And then on the left, second intercostal space. Going down to herbs in the third intercostal space. Tricuspid in the fourth intercostal space. And then midclavicular line in the fifth intercostal space for mitral. And with the heart sounds, I'm just noting for an S1, S2 sound. And then if I hear S3, S4, a murmur, or any other abnormalities in those heart sounds, I will document and send out for further testing unless that is their normal and that they have other documentation on that. I'm going to go ahead and have you lean forward, and I'm going to listen to the lung sounds in the back. Again, just one breath every time. Good, one more. Good. I'm gonna come back up to the head really quick, and I'm gonna take you through the Ryan and the Weaver test. I'm gonna hit my tuning fork, and I'm gonna hold it in the middle of the skull, making sure that they can hear the same thing equally on both sides, and the sound diminishes at the same time for the Weaver test. And then for the Ryan test, I'm gonna hold it back here, keep your head straight, and I'm gonna note the time that they've stopped hearing the noise on the bone, and then I'm gonna hold it out right next to their ear and note the time that they stop hearing it in the air. Air conduction is greater than bone conduction, but not by double. Okay, I'm gonna have you go through range of motion of the lower extremities now. So bring your feet all the way out. Good. Bring them all the way back. Good. Push against me. Good. Pull against me. Good. Toes up. Good. Toes down and hold them. Good, push against me and pull against me. Good, now bring your toes in, bring your toes out. Good. I'm going to show you hip external rotation, and then I'm gonna have you do it on your own. So bring your leg in like that for me. Good, don't let me push you out. Good, do it again on this leg. Good, don't let me push you out. Good. Noting for any scarring, lesions, abnormal moles or masses, bruising and swelling, and any muscular atrophy within the lower extremity of the legs. I'm gonna have you swell cheeks, clench. Good. I'm gonna have you stand up for me and turn around. I'm gonna watch for symmetry of breathing pattern, note C7, and then down to T9, T10. I'm gonna put my thumbs on the musculature and have you take a deep breath in. Good, and deep breath out. Good, and I'm just watching for the symmetry of the musculature and contour of the musculature, as well as the symmetry of the breathing pattern as my thumbs go out at the same time and in at the same time. I'm now gonna finish palpating down the spine, noting for any abnormalities felt in the vertebrae and vertebral separation. I'm gonna have you bend over and touch your toes. Good, and I'm gonna note for any abnormal curvature of scoliosis, kyphosis, and lordosis noted in the spine. I'm gonna have you bring each leg back into hip extension. Good, no, just straight. Good, and then each leg out and in for hip adduction and abduction, and then back into center. Good. And now I'm gonna have you lay down on your back with your head over here, and I'm gonna just take a listen and feel for your abdomen. So I already looked at the abdomen, the skin, the contour, the symmetry of that, noting any scarring lesions, noting the hair on the abdomen and the chest of this patient, and now I'm gonna listen to bowel sounds. I'm going to listen for a minute in each quadrant, starting with the right lower quadrant, and then I'm going to listen for 5 minutes if I feel that bowel sounds are absent before noting that they are absent in the chart. Good, just taking note of the active bowel sounds by listening for crackles and gurgles. Then I would take note if they were hypoactive, hyperactive, or inactive, if that were the case with my patient. I'm going to now percuss. Making sure that the sound over the abdomen is the same in each quadrant, and then I'm going to do some palpation as well around the abdomen, noting for masses, tenderness, swelling, or discomfort amongst their abdomen during that test. I can also feel for the popliteal pulses, femoral pulses, and then posterior tibial and the dorsalis pedis pulses as well, making sure that their peripheral vascular system is all intact. I can check capillary refill on the nails within 2 seconds on the toes and the fingers, also noting any clubbing or deformities of the nail beds, and making sure that there are no scarring lesions or discoloration like cyanosis noted within those nail beds as well. And then I'm going to sit you up. And you are all good to go.
Thank you.
You're welcome.